Former President Jimmy Carter will begin radiation treatment for several melanoma spots on his brain just this afternoon. Carter making the announcement at a news conference this morning in Atlanta. He says he learned about it after he had a mass removed from his liver earlier this month and described his initial reaction.
We had an MRI of my head and neck, and it showed up that it was already in 4 places in my brain. So I would say that night and the next day until I came back up to Emory, I just thought I had a few weeks left. But I was surprisingly at ease. But now I feel, that it's in the hands of God, whom I worship, and I'll be prepared for anything that comes.
MSNBC's Sarah Daloff is live in Atlanta. I'm joined also by Dr. David Spigel, director of the Lung Cancer Research Program at the Sarah Cannon Research Institute. Let's start with you here, Sarah. He started his remarks with what some might say was a tone that was not as confident as he usually is, something that was perhaps a little bit more emotional. What was it like there as you watched this?
Well, it was so surprising, Richard, to hear how candid and open and honest the former president was. Also that he was able to joke around and be in such good spirits while talking about such a difficult experience that he's about to undergo. As you mentioned, he begins his first radiation treatment later today here in Atlanta at Emory Hospital. He'll also be given a drug that helps stir up his autoimmune system. He says he's hoping for the best, but he is prepared for whatever comes. His grandson, Jason Carter, will be stepping into the role of chairman here at the Carter Center. They say that is a transition that was planned well before any cancer diagnosis.
Jason Carter, who was running for governor there in the state of Georgia. Dr. Spigel, you've been watching the comments being made by former President Carter. He was saying he has 4 melanoma spots on his brain, but it started with his liver. How serious is the spread, or might that spread be related to his prognosis?
Yeah, it's a good question. We think obviously this would start from the skin, and the liver was one spot where this spread to. It's interesting in his disclosure that he describes just the brain and the liver. As an oncologist, I'm very encouraged by the fact that we're really dealing with 2 sides of disease, but I know the public is wondering, well, where else could this cancer be? Our best tests can find cancer in places. They're not perfect, but we go after the places where we know it is. So he described having a mass removed in the liver. That sounds like that was very successful. And now, hopefully, those 4 minute spots will be eradicated with radiation therapy.
Dr. Spigel, when we're looking at his age, a concern here?
It's always a concern because, even though a 90-year-old person can be younger in terms of all their activity, and we know President Carter is certainly can run laps around people much younger than him, we still know the organs in the body can be older. What's interesting, though, the drug he's going to be receiving, a drug to boost his immune system, pembrolizumab, the key study that used that drug and compared it to standard therapy included patients as old as 89. So a good example of how these new therapies can still be used in our elderly patients.
Birthday pictures for his wife, Rosalind, there. Sarah, President Carter and his wife, very close, as we see right here. Here's what he said about what he was most proud of in his life.
The best thing I ever did was marrying Rosalind. That's the pinnacle of my life. And we've had 69 years together, still together. And so that's the best thing that happened to me.
And so how is Rosalind dealing with this? Sarah?
Yeah, that's a great question, Richard. She reportedly took the initial news harder than the former president, but you saw her there at the press conference today, sitting in the front row, listening to her husband speak. She appeared to be in good spirits. As for the rest of the family, they say they are grateful. They know they have a little bit more time with Mr. Carter. His grandson, Jason Carter, is reminding people that today was not a eulogy, that his grandfather plans to follow whatever course of action his doctors recommend, and he plans to stay as active as possible while doing so. For example, he is scheduled to teach Sunday school this coming weekend at his hometown church. He's also hoping that he might still be able to go on a planned humanitarian trip to Nepal, Richard. However, his treatment might interfere with that. Back to you.
MSNBC Sarah Daloff, Dr. David Spigel, thank you both. Up next, fallout.